All right, studies estimate that more than 1/3 of college students take attention deficit drugs without a prescription, and they say it helps them focus or give them more energy to study during stressful times at school.
But they often get the pills from their pals who are properly prescribed the medicine. Schools around the country are buckling down on this buddy system of swapping stimulants. And as ABC 2 News' Charlie Krausen explains tonight, some claim they're discriminating against those who truly need the drugs.
What would you do if your doctor asked you to sign a contract the next time you were prescribed medication? Or what if you were required to submit to a drug test in order to get a prescription filled? It's happening at some college clinics around the country when students look for help treating attention deficit hyperactivity disorder, or ADHD.
These are unfortunate kind of barriers for those who need the treatment.
Studies document rampant misuse and abuse of ADHD medications on college campuses. This student, who asked that we not share his identity, explained he didn't get his first prescription until his first year of college.
I had a bunch of friends that were on them, and I had taken some of theirs, and that helped me.
So he asked a doctor to write him a prescription.
I've never sold them, but I have given them away.
And that's the problem. Schools are having a hard time keeping up with the demand and the expense for treatment and diagnosis. And they're concerned about medical liability, so many are now taking up new policies.
Recently, a number of campuses have announced that they will no longer prescribe stimulant medication for those students with attention deficit disorder.
Those schools are leaving it to the student to get their meds back home or off campus. Other schools say they'll fill the scripts, but won't do any diagnosing.
They base it on the fact that it has been diagnosed in the past.
Still, other schools are making it much more difficult for students to get their hands on the drugs, even for those already diagnosed. Students have to meet certain testing requirements, which often include signing a contract.
It states that they will notify us if they are prescribed medication by anyone else, if they are on any kind of other addicting kinds of medications that wouldn't mix. They promise that they will not abuse any drugs. They promise not to share or sell their medications to roommates. And importantly, they promise to follow through with therapy.
The contract also gives consent for periodic random drug testing.
If we think somebody might be coming in and getting a prescription so they can sell it on the street, that allows us the opportunity to determine that they're truly taking the medication.
But not everyone agrees these changes are good. Ruth Hughes heads up the advocacy group Children and Adults with Attention Deficit Hyperactivity Disorder. She's worried this stigmatizes students who really need the drugs to succeed.
We're making it harder and harder for them to have access to good treatment and to have support. You know, if somebody has asthma and has to take asthma medication every day, or diabetes, or high blood pressure, we would question their need for medication.
The medical facilitators argue colleges face a tough dilemma.
We need to have these protocols in place, but believe me, our last resort is to turn down somebody that we think has ADHD.
Some schools consider unauthorized drug use to be cheating or maybe breaking that school's honor code. The result could be expulsion for that student. Charlie Krausen, ABC 2 News.